Turns out that sex is not on the cards anymore. Sex stops, ladies and gentlemen. It is like your work is done. Because leading up to having the baby, it's like flowing like gold. It's literally everywhere. It's like you want to do it on the stairs, you want to do it in the bedroom, it's like great. And then suddenly it's like cold turkey. It's completely and utterly stops. And the thing is the excuse is, I don't want the baby to feel your penis.
But that's what I really feel.
Yes, in early pregnancy, your sex drive will be all over the place, and you might be wondering if it is still safe, so we need to talk about sex in pregnancy. There's actually no right answer to what you can expect from sex in pregnancy because everyone is different. So let's start with the safety. For most people, sex is totally safe throughout pregnancy, right up until your waters break, unless your doctor has given you a specific reason that you should avoid it, like if you've got a placenta previa, or if you've had signs of preterm labour, or you've got some unexplained vaginal bleeding. But just because you can have sex in pregnancy doesn't mean you would want to. So what actually happens to your sex drive? Well, in your first trimester, there's a lot going on. It's very normal to feel too tired, too nauseous, or bloated to even think about sex, and that's normal. Others feel no different to normal, or they even have an increase in their usual libido. And by the second trimester, hormones like estrogen are rising, blood flow is increasing, symptoms from the first trimester are improving, and lots of people do notice a boost in their libido. This could be the golden window where sex does feel more comfortable again, but not for everyone. Your changing body, your ongoing exhaustion means you might still not get that boost in libido either. And then, in the third trimester, things can get tricky again. Your bump is bigger, your joints may ache, other positions might be awkward, and that doesn't mean intimacy has to stop, but you might just need to get creative with different positions and go gently. Also, no, you're absolutely not going to poke the baby. Your cervix acts as a good barrier, and your baby is very well protected. Inside the uterus, there's plenty of fluid around it and other muscle and tissue layers that act as a cushion. So even the most well-endowed partner can't make it that far. So, bottom line is there's no right way to feel about sex in pregnancy. Whether you're feeling more connected to your partner physically or like you just want to be left alone, it's all valid. Talk to your partner, ask your medical team if you're unsure, and remember that sex in pregnancy doesn't have to be off limits unless you want it to be. Let me know how you got on in pregnancy.